Hi there, I'm Dr. Stephen Phelan. Welcome to this video. This is Webinar Questions Answered, and during these videos I answer a question from one of my webinars. Today I'm going to be answering a question from my video webinar, my Altering the Vertical Dimension Case Studies webinar. An easy URL to register for this webinar if you're interested is videoseminar.com. So you can go to videoseminar.com and register for the Altering the Vertical Dimension Case Studies webinar. One question that we've had from a number of attendees regards the leaf gauge. So a number of different attendees, Dr. Gill, Dr. Cara Demetrio, Dr. Prado, a number of people are asking, where can I buy the leaf gauge? What is the leaf gauge? Can you please tell me what the leaf gauge is? So we do get a number of questions about the leaf gauge, and the leaf gauge is simply a tool that I use to create a CR bite record. So the leaf gauges that I use, they're from Great Lakes Orthodontics. Here they are bagged after being sterilized, and I can open one up and share it with you. Below this video, I'll make a link to the page that Great Lakes Orthodontics has their leaf gauge information on. The nice thing about these leaf gauges is, again, they're sterilizable in little baggies, and they don't get wrecked during sterilization. Some leaf gauges, if you've used these before, get destroyed during sterilization or repeated sterilization. And all this is it's a little gauge to open the vertical during the bite record. And what we do, I share this again in Module 1 of Occlusion Design, showing different videos, but we have the patient bite down on this leaf gauge, which we can change the vertical height of, because it's a whole bunch of little leaves. We can change the vertical height to be appropriate for that patient so that they have roughly 1.5 millimeters to 2 millimeters of clearance in the posterior teeth. I have them bite down on this. I ask them to slide forward, slide back, and squeeze. In a healthy joint, when they slide back, the muscles will seat them in CR. So we're trying to take a CR bite record so we can mount the case in CR on the SAM3 articulator and then have the diagnostic wax-up completed after our diagnosis and treatment planning. So all it is a simple little gauge. I can change the height with this. It's repeatedly sterilizable. We can have the patient bite down, slide their lower jaw forward, slide back. When they're sliding back, their elevator muscles seat the condyle into CR, and we ask them to squeeze, and they're in CR. Now, patients who don't have a healthy joint won't be in CR. They will feel pain. So you're load testing with the leaf gauge. When we load test, we ask them, are you feeling tension or tenderness or pain when you're doing this with the leaf gauge? If they feel pain, they're not in CR, we don't take the bite. If they have a lot of pain, it's likely a joint problem. We probably shouldn't be doing a rehab type of case on that patient. We need the joint investigated, so likely an MRI. If the patient has, the common thing we hear is, I feel tension, and they're pointing below the joint, kind of in the elevator muscle area. That's often elevator muscle tension or lateral pterygoid muscle tension. And frequently that'll go away during the leaf gauging appointment, during the functional analysis appointment. We have a few strategies to do that, deprogramming those elevator muscles that I go through in Module 1 of Occlusion Design. But one thing to keep in mind, if they don't deprogram and the patient's having a lot of tension when they're trying to do a bite record with the leaf gauge, that's not a CR bite record. It's not accurate. So you have to do something. A lot of the time, the solution would be some form of deprogrammer. I like the Cois deprogrammer. It's a nice designed deprogrammer that we can use. I can have that made fairly inexpensively and have the patient deprogrammed for a few weeks, and at that point they usually don't have that muscle tension anymore, and we can take the bite record. Sometimes they still have a little muscle tension after a week or two. We might adjust the deprogrammer, have them use it for another week or two, and typically we will get them to a point where they don't have that muscle tension anymore. So yeah, that's basically the leaf gauge. As I said, you can get that from Great Lakes Orthodontics, at least the one that we're using. I highly recommend this one just because of the way it's designed, and it can be repeatedly sterilized. We do this every day, sterilizing those, and they seem to hold up pretty well. So I'll put the link below that. If you'd like to know about one of my free training webinars, the one that this question was from is my Altering the Vertical Dimension Case Studies webinar. We have a few different URLs for that, but the easiest one is videoseminar.com. You can go to there, click to register, and you could attend the entire training, which is multiple hours of training showing 3 different case studies that I'm altering the vertical dimension with, using different techniques. And one of the case studies actually from this wax up, from this particular wax up, it's one of the case studies in this seminar. So that's basically it. I'm Dr. Stephen Phelan. Thank you for joining me today, and we'll talk to you soon. Take care.